Hello and welcome to our educational series on Bipolar Disorder, Module 4. My name is Amelia, and together with my colleague Mark, we want to empower you to better manage your condition and improve your overall quality of life, or to help someone better manage their condition. In this module, we will discuss what you or your loved one can do to cope when you notice any early warning signs of bipolar symptoms.
Thank you, Amelia. In this module, you will learn about effective or helpful ways to cope with worsening symptoms and about less helpful ways of coping. We will also discuss ways that friends or family members can help. Remember, with managing bipolar disorder, the goal is to catch symptoms early and take action early. It's helpful to develop one action plan for hypomanic or manic symptoms and one for depression symptoms. This is because the treatment to prevent symptoms from getting worse are different, depending on the type of mood episode. For most people with bipolar disorder, symptoms of depression are more frequent. Let's begin by discussing helpful ways of coping with these symptoms. Depression is often associated with a change in a person's behavior. This can look like sleeping more, isolating more from other people, avoiding doing activities, or generally just doing less. This makes sense, as typically depression is associated with having less energy. However, while these behaviors may feel good in the short term, they can actually make symptoms of depression worse. It can be difficult, but in order to interrupt the depression cycle, the best place to start is to make a change in behavior. For symptoms of depression, the strategy is to do more activity. For individuals with bipolar disorder, it is also important to pace activity, which means not doing too many activities, as doing too much activity can lead to being overstimulated. Schedule activities and schedule time to rest. Generally, activities that you or your loved one enjoy or enjoyed in the past, activities that lead to a sense of accomplishment or social activities can be helpful. Activities that lead to a sense of accomplishment can be activities such as waking up at a reasonable time, taking a shower, eating healthy, going for a walk, exercising, doing a household chore, or running an errand. Social activities are activities that involve other people, such as contacting or getting together with a friend or family member, attending a peer support group, or even spending time in a different location where others are, such as a library, mall, or coffee shop. Maintaining activity when depression is worse is important, even if you or your loved one feel unmotivated. It is helpful to develop a written action plan ahead of time. Think about what you or your loved one can do when symptoms of depression worsen and write them down. That way, when needed, you can refer back to the plan. Family members and friends can help to encourage individuals with bipolar disorder to follow their action plan. Although it can be really difficult when people are depressed, it is helpful to try to follow a plan and not follow the feelings associated with depression or the urge to do less activity. Less helpful ways of coping with symptoms of depression include taking more naps, or using substances such as alcohol, cannabis, or other drugs to cope. Alcohol is actually a depressant substance, which means it makes mood symptoms worse. At this time, the evidence on cannabis use and bipolar disorder is more limited. However, there is some evidence to suggest potential risks. We know from research that problematic substance use is a significant problem for many people with bipolar disorder. If you are using substances, there are also ways to use substances more safely. This is called a harm reduction approach. This approach helps to reduce harms associated with substance use without requiring you to stop use completely, if that is your choice. Talk to a healthcare provider if using substances is problematic for you or your loved one. If you or your loved one has been struggling with symptoms of depression that have lasted for longer than 2 weeks, it is a good idea to get in contact with a healthcare provider. It is also important to continue to take psychiatric medication as prescribed. If you or your loved one needs help to develop an action plan, seek out assistance from a healthcare provider.
Like depression, hypomania, or mania is often associated with a change in a person's behavior. However, this is typically in the opposite direction, as hypomania and mania are associated with having more energy. This can look like sleeping less and generally doing more activities. In this case, doing more activity and getting less sleep can actually make symptoms of hypomania and mania worse. It can be difficult, but in order to interrupt the hypomanic or manic cycle, the strategy is to limit or do less activity or keep activity at a usual level. This also applies to mixed episodes. If an individual is experiencing any hypomanic or manic symptoms, the goal is to slow down and do less. In the event of any identified hypomanic or manic symptoms, it is important that individuals continue to take their medication and contact their healthcare provider. Next, it can be helpful for individuals to get to sleep. This might include using any prescribed sleep medication if necessary. If an individual is having trouble going to sleep, it can be helpful to lie down and rest. In general, it is helpful to reduce stimulation, as this can make symptoms of hypomania and mania worse. This can be external stimulation, which is stimulation from the environment, and/or internal stimulation, which is stimulation inside the body. To reduce external stimulation, individuals can avoid social situations or settings, such as going to a party, being in a crowd, or being in a loud coffee shop, restaurant, shopping mall, or bar. Individuals could also turn off lights and reduce any noise. It can also be helpful to limit activities to only those that are necessary. At this time, the relationship between exercise and hypomania and mania is unclear. There is some preliminary research that some forms of exercise could potentially worsen hypomanic and manic symptoms. Individuals often find it easier to reduce external stimulation versus internal stimulation. To reduce internal stimulation, individuals can avoid drinking anything stimulating, such as any caffeinated drinks, for example, coffee, tea, or energy drinks, and avoid any alcohol and other drugs. In addition, if you or your loved one have learned a relaxation or breathing exercise from a healthcare provider, this can also be helpful. Lastly, it can be helpful for you or your loved one to remove or put away credit cards and car keys, because hypomania and mania can be associated with spending, speeding, or other risky behavior. It is also helpful to hold off on making any big decisions. As discussed with respect to depression, it is helpful to develop an action plan ahead of time. Think about what you or your loved one can do when you notice early signs of hypomania or mania. That way, when needed, you can refer back to the action plan. Less helpful ways of coping with symptoms of hypomania and mania include stopping medication and using substances. In fact, there are certain substances or drugs that can cause hypomanic and manic symptoms. If you or your loved one needs help to develop an action plan to cope with early symptoms of hypomania or mania, seek out assistance from a healthcare provider.
It is helpful for an action plan to include what to do in the event of an emergency or risky situation. Thoughts of suicide are common in bipolar disorder. If you are thinking about hurting yourself or your loved one is having these types of thoughts, help is available. First, individuals should tell a loved one if they are having thoughts of harming themselves or others. Individuals can also contact a crisis or distress line, call 911 or 988 or their local emergency number, or go to their nearest emergency room. People with bipolar disorder, family members, or housemates can also help to make the home safer. This might include removing sharp objects, weapons, guns, or dangerous chemicals, and helping to store medication or limiting access to large amounts of medication. If you are very concerned about a loved one's safety to either themselves or others and they are choosing not to get help, this can be especially difficult. A family member or friend can contact a justice of the peace in Ontario to make a request that allows a police officer to take the person to a hospital for an assessment. We encourage individuals to develop an action plan for hypomanic or manic symptoms and one for depression symptoms. Individuals can share these action plans with family members and friends who can provide support. The goal is to follow a coping plan as soon as you or your loved one notice any warning signs. Coping involves managing symptoms when they appear, but also involves planning ahead to prevent symptoms.
That brings us to the conclusion of this module. We hope that you have learned about some of the key ways of coping with bipolar symptoms. and learn that the way to cope depends on the type of mood episode. In the next module, we will discuss the importance of regular habits and stress management,